Imagine doing everything right for your hair, good oils, good shampoo, even supplements, and still watching strands fall out. What if the problem isn't zinc itself, but the type of zinc you're using? Today I want to clear up a massive confusion around zinc and hair growth, specifically zinc gluconate versus zinc oxide, and which one actually supports real hair regeneration. This is Dr. Eric Berg DC, and this one detail could make all the difference for your hair. Zinc is not optional when it comes to healthy hair. Your hair follicles are some of the fastest dividing cells in the body, and zinc is required every time a new hair cell is formed. Without enough usable zinc, the hair cycle shortens, hair becomes thinner, and shedding increases. Zinc also controls oil gland activity around the follicle, supports protein synthesis for keratin, and keeps the immune system from attacking the hair root. So when people say zinc is important for hair, that's an understatement. Now here's where the confusion starts. Not all zinc supplements behave the same way in the body. Two of the most common forms people see on labels are zinc gluconate and zinc oxide. On paper, they both say zinc, but inside your body, they act very differently. Let's start with zinc oxide, sometimes mistakenly referred to as oxidize. Zinc oxide is an inorganic form of zinc. It's very stable, very cheap, and that's why it's widely used in multivitamins and even in topical products, like sunscreens and diaper creams. The problem is absorption. Zinc oxide has very low bioavailability. That means only a small fraction of it actually gets absorbed through the digestive system. Most of it passes right through. For hair, this is a big issue. Hair follicles don't just need zinc to be present in the gut, they need zinc to reach the bloodstream, then the scalp, then the follicle itself. Zinc oxide struggles to do that. So someone can be taking zinc oxide every day, think they're supporting hair growth, and still be functionally zinc deficient at the follicle level. Another issue with zinc oxide is that it can be irritating to the stomach in some people. This irritation can reduce compliance, meaning people stop taking it regularly or they take it with food that further blocks absorption. Phytates from grains, legumes, and even some seeds bind zinc oxide very easily, making absorption even worse. So in real-world conditions, zinc oxide often underperforms. Now let's talk about zinc gluconate. Zinc gluconate is an organic zinc salt bound to gluconic acid. This structure makes it much easier for the body to recognize, transport, and absorb. Compared to zinc oxide, zinc gluconate has significantly higher bioavailability. More of it actually enters the bloodstream and becomes available to tissues that need it, including the scalp and hair follicles. This matters because zinc isn't stored in large amounts in the body. You need a steady, absorbable supply. Zinc gluconate delivers zinc in a form that can support enzymes involved in DNA replication, cell division, and protein synthesis, all critical steps in hair regeneration. When hair follicles finally get enough usable zinc, the growth phase of the hair cycle can lengthen, shedding can slow, and hair shafts can grow stronger. Zinc gluconate is also gentler on the stomach for most people. That means better consistency, better compliance, and better results over time. And consistency is everything when it comes to hair growth. Hair doesn't respond overnight. It responds to months of proper nutrition reaching the follicle without interruption. Another important factor is inflammation. Zinc has anti-inflammatory and antioxidant properties, but again, only if it's absorbed. Zinc gluconate helps regulate immune responses around the follicle. This is especially important for people dealing with diffuse hair thinning, stress-related hair loss, or conditions where the immune system quietly disrupts the hair cycle. Zinc oxide, because of its poor absorption, often fails to deliver this benefit where it matters. Now let's clear up a common misconception. More zinc does not mean better hair. Taking high doses of poorly absorbed zinc oxide won't compensate for low bioavailability. In fact, excessive zinc can interfere with copper absorption, which can actually worsen hair problems. The goal is not more zinc, but the right form of zinc, taken in a reasonable amount that your body can actually use. For hair support, zinc gluconate is generally a better option than zinc oxide because it reaches the follicle, supports keratin production, helps regulate oil glands, and stabilizes the hair growth cycle. When combined with adequate protein, B vitamins, and trace minerals, zinc gluconate can become a powerful part of a hair regeneration strategy. One more thing to keep in mind is timing. Zinc is best absorbed away from high phytate foods and often works better when taken with a small amount of protein. This further improves delivery to tissues like the scalp. Again, this advantage is more noticeable with zinc gluconate than zinc oxide. So if you've been taking zinc and not seeing results, don't assume zinc doesn't work. It may simply be the wrong form. Hair follicles are extremely sensitive to nutrient quality, not just quantity. Zinc gluconate gives your follicles a form they can actually recognize and use, while zinc oxide often looks good on a label but falls short where it counts. If you want healthier, stronger, thicker hair, focus on absorbable minerals, not cheap fillers. Zinc is essential, but the form determines the outcome. When we say zinc is essential for hair regeneration, most people nod their head and move on, but very few truly understand what that statement means at the cellular level. Hair doesn't just grow, it is built, step by step, cell by cell, deep inside the follicle. And every one of those steps depends on whether zinc actually makes it into your bloodstream and reaches the scalp. Simply swallowing zinc is not enough. If zinc doesn't get absorbed, transported, and delivered to the follicle, your hair simply cannot respond. Hair follicles are among the most metabolically active structures in the body. They divide rapidly, they synthesize large amounts of protein, and they require constant DNA replication. Zinc plays a role in all of these processes. It acts as a cofactor for over 300 enzymes, many of which are directly involved in cell division and tissue repair. When zinc is missing at the follicle level, the hair cycle shortens. The growth phase becomes weaker, the resting phase becomes longer, and shedding increases. One of the biggest misunderstandings people have is assuming that if zinc is listed on a supplement label, their hair follicles are automatically receiving it. That is not how the body works. Zinc must first survive stomach acid, then be absorbed through the intestinal lining, then bind to transport proteins in the blood, and finally be delivered to peripheral tissues like the scalp. If any step in that chain fails, the follicle remains zinc deficient even though supplementation is happening. This is why we often see people with normal or borderline zinc intake still experiencing hair thinning. The issue isn't always intake, it's utilization. Hair follicles are not a priority tissue for the body. If zinc is limited, the body diverts it to critical organs and immune functions first. Hair comes last. That means even a mild problem with absorption can show up as hair loss long before it shows up on a blood test. Zinc's role in hair regeneration starts with keratin production. Keratin is the structural protein that makes up the hair shaft. Zinc is required for the enzymes that assemble amino acids into keratin strands. Without enough zinc at the follicle, keratin production becomes faulty. Hair grows thinner, weaker, and more prone to breakage. This is why zinc deficiency often shows up as brittle hair, slow growth, or diffuse thinning rather than complete bald spots. Zinc is also critical for DNA synthesis. Every time a hair follicle produces a new hair cell, DNA must be copied accurately. Zinc stabilizes DNA structure and supports the enzymes that control replication. When zinc delivery to the follicle is compromised, cell division slows, hair growth becomes sluggish, and follicles may prematurely exit the growth phase. Another key function of zinc is regulating the oil glands around the follicle. These glands produce sebum, which protects the scalp and hair shaft. Too little zinc can lead to dry, irritated scalp conditions, while dysfunctional zinc metabolism can also contribute to excess oil and clogged follicles. Both extremes interfere with healthy hair growth. Proper zinc delivery helps maintain balance, creating an environment where follicles can thrive. Immune regulation is another often overlooked factor. Many forms of hair thinning involve low-grade inflammation around the follicle. The immune system may not be attacking aggressively, but it creates enough disturbance to disrupt the growth cycle. Zinc helps regulate immune signaling and reduces unnecessary inflammation, but again, this benefit only occurs when zinc reaches the scalp tissue. Poor absorption means the immune imbalance continues unchecked at the follicle level. Stress further complicates this picture. During physical or emotional stress, zinc requirements increase. Stress hormones alter digestion, reduce stomach acid, and impair mineral absorption. This means that during the very times when hair loss accelerates, zinc delivery to the follicle is often at its worst. People may increase zinc intake during stress, but if absorption is compromised, the follicle still doesn't benefit. This is why the phrase hair follicles only respond when zinc is absorbed into the bloodstream and delivered to the scalp is so important. Hair is not responding to what you swallow. Hair responds to what arrives. That arrival depends on digestive health, zinc form, competing nutrients, and overall metabolic state. Another layer to this is protein status. Zinc works hand in hand with protein. Transport proteins in the blood carry zinc. If protein intake is low or digestion is impaired, zinc transport suffers. Hair follicles may be starved of zinc even when supplementation appears adequate. This explains why zinc works best as part of a broader nutritional foundation rather than as a single isolated fix. Age also affects zinc delivery. As we get older, stomach acid production often declines. Lower stomach acid reduces zinc ionization, which is necessary for absorption. This means older adults are especially prone to functional zinc deficiency at the follicle level. Hair thinning with age is not just hormonal, it is often nutritional and absorption related. Medications can further block zinc absorption. Antacids, acid blockers, and certain antibiotics interfere with zinc uptake. Someone taking zinc while also using these medications may see little to no benefit for hair. Again, the issue is not zinc itself, but zinc reaching the target tissue. When zinc does reach the follicle consistently, something remarkable happens. The hair growth cycle begins to normalize. The growth phase extends. Shedding gradually decreases. New hairs emerge thicker because the follicle finally has the resources it needs to build strong keratin structures. This does not happen overnight, but over months of steady zinc delivery, the scalp environment changes. It's also important to understand that zinc deficiency at the follicle level doesn't always show up as dramatic baldness. It often shows up subtly. Hair stops grow. Wing past a certain length, ponytails feel thinner, parts look wider, hair sheds evenly rather than in patches. These are classic signs of a nutrient delivery issue rather than a genetic one. Blood tests for zinc can be misleading. Serum zinc represents a very small fraction of total body zinc and is tightly regulated. You can have a normal blood zinc level and still have zinc-starved hair follicles. This is why focusing solely on lab numbers without considering absorption and delivery can lead to frustration. The scalp itself has a unique microcirculation. Nutrients must pass through tiny blood vessels to reach the follicle. Poor circulation, insulin resistance, or chronic inflammation can impair this delivery system. Zinc must not only be absorbed but also successfully transported through this microvascular network. Supporting overall metabolic health indirectly improves zinc delivery to hair. One of the most powerful shifts people can make is moving from thinking about supplements as pills to thinking about them as delivery systems. Hair follicles don't care how expensive a supplement is or how popular it is. They care whether nutrients arrive in a usable form, at the right time, consistently. When zinc delivery improves, the follicle exits survival mode. It stops conserving energy. It starts building. That is the foundation of hair regeneration, not magic, not overnight fixes, just biology working the way it was designed to when given the right tools. So, the real takeaway here is simple but profound. Zinc is essential for hair regeneration, but only the zinc that is absorbed, transported, and delivered to the scalp actually counts. Anything less is just passing through. If your hair isn't responding, it's not always because zinc doesn't work. It's often because the follicle never received the message. We talk about zinc gluconate being more bioavailable and gentler on digestion than zinc oxide. We're really talking about how the body recognizes, handles, and uses zinc at a very practical level. Hair regeneration depends on consistency and efficiency, not just taking something occasionally and hoping for the best. Zinc gluconate fits into the body's natural absorption and transport systems in a way that zinc oxide simply does not. And that difference becomes critical when the goal is healthier, stronger hair over time. Bioavailability means how much of a nutrient actually gets absorbed and becomes usable by the body. This is where many people get misled. A supplement label may show a high milligram number, but that number does not tell you how much zinc will actually enter your bloodstream. Zinc gluconate is bound to gluconic acid, an organic compound that helps zinc stay soluble in the digestive tract. This solubility allows zinc ions to pass more easily through the intestinal lining and into circulation. Zinc oxide, on the other hand, is poorly soluble in water. In the acidic environment of the stomach, it does not break down efficiently into absorbable zinc ions. Much of it remains intact and moves through the digestive system without ever being absorbed. This is one of the main reasons people can take zinc oxide for months and see little to no improvement in hair quality or shedding. Hair follicles are extremely sensitive to nutrient availability. They respond not to what is ingested, but to what arrives at the follicle consistently. Zinc gluconate provides a steadier and more reliable supply of zinc to the bloodstream, which means hair follicles are more likely to receive what they need day after day. Over time, this steady delivery supports the enzymes involved in keratin production, follicle repair, and structural integrity of the hair shaft. Another major advantage of zinc gluconate is digestive tolerance. Many people experience nausea, stomach pain, or discomfort when taking zinc supplements, especially on an empty stomach. Zinc oxide is notorious for causing this irritation. When digestion is irritated, absorption often decreases even further. People may start skipping doses, taking the supplement with heavy meals, or stopping altogether. This inconsistency completely undermines hair regeneration. Zinc gluconate is generally much gentler on the stomach. Because it is better tolerated, people are more likely to take it consistently. This consistency is essential for hair growth. Hair follicles operate on long timelines. They need weeks and months of stable nutrient supply to shift from a shedding pattern to a growth pattern. A supplement that causes discomfort cannot support that long-term process effectively. Keratin production is one of the most zinc-dependent processes in the body. Keratin is a tough, fibrous protein that gives hair its strength and structure. Zinc activates enzymes that link amino acids together to form keratin strands. When zinc delivery is unreliable, keratin synthesis becomes incomplete. Hair may grow, but it grows thinner, weaker, and more fragile. Zinc gluconate, by improving zinc availability, helps ensure that keratin production is strong and continuous. Follicle repair is another critical area where zinc gluconate shows its advantage. Hair follicles undergo constant microdamage from styling, environmental exposure, inflammation, and oxidative stress. Zinc supports cellular repair mechanisms by stabilizing cell membranes and activating antioxidant enzymes. With better zinc delivery, follicles can recover more efficiently from stress instead of slipping prematurely into the resting phase. The hair growth cycle itself is tightly regulated by nutrient signaling. Zinc plays a role in maintaining the length of the growth phase. When zinc levels at the follicle are low, the growth phase shortens and more hairs enter the shedding phase. Zinc gluconate helps maintain a more favorable environment for a longer growth phase, which over time translates into increased hair density and reduced shedding. Oil gland regulation is another area where zinc's effects depend heavily on absorption. Zinc helps balance sebum production around the follicle. Too much oil can clog follicles and interfere with growth, while too little oil can dry out the scalp and weaken hair shafts. Zinc gluconate's improved absorption allows it to regulate these glands more effectively, supporting a healthier scalp environment. Inflammation control is also strongly influenced by zinc status. Low-grade inflammation around hair follicles is a common but often unnoticed contributor to hair thinning. Zinc helps regulate inflammatory signaling and supports immune balance. Zinc gluconate's higher bioavailability means it is more likely to reach the scalp tissues where this regulation is needed. Zinc oxide often fails to deliver enough zinc to have a meaningful anti-inflammatory effect at the follicle level. Another important factor is interaction with other nutrients. Zinc competes with minerals like iron and copper for absorption. Because zinc gluconate is more efficiently absorbed, it can be taken in lower, more balanced doses that reduce the risk of mineral imbalance. Zinc oxide often encourages higher dosing to compensate for poor absorption, which increases the risk of disrupting copper balance and potentially worsening hair issues. Zinc gluconate also integrates better into transport systems in the blood. Zinc binds to proteins like albumin to reach peripheral tissues. Efficient absorption supports this transport process. Hair follicles rely on these transport proteins to deliver zinc through tiny blood vessels in the scalp. Zinc oxide's poor absorption means fewer zinc ions are available for transport in the first place. Over time, the difference between these two forms becomes very noticeable. With zinc gluconate, people often report gradual reductions in shedding, improved hair texture, and stronger strands. These changes are subtle at first, but they compound over months. With zinc oxide, progress is often inconsistent or absent, leading people to conclude that zinc simply doesn't work for hair. Another overlooked aspect is stress resilience. During stress, the body uses zinc more rapidly. Better absorbed zinc helps buffer this increased demand. Zinc gluconate supports adrenal function, immune regulation, and tissue repair during stress, indirectly protecting the hair growth cycle. Zinc oxide often cannot keep up with these demands due to limited absorption. Zinc gluconate also supports wound healing in the scalp. Tiny injuries from scratching, irritation, or inflammation heal faster when zinc is available. Faster healing means less disruption to follicle activity and a more stable growth environment. Again, this benefit depends on zinc actually reaching the tissue. The gentler digestive profile of zinc gluconate also means it is more compatible with long-term use. Hair regeneration is not a short-term project. It requires sustained nutritional support. A form of zinc that can be taken daily without discomfort has a much higher chance of delivering real results. What this all comes down to is efficiency. Zinc gluconate allows the body to use zinc the way it was designed to. Instead of forcing the system with high doses and hoping some zinc slips through, it works with natural absorption pathways. This efficiency is exactly what hair follicle less need. When zinc is consistently delivered in an absorbable form, follicles receive clear signals to build, repair, and grow. Keratin production improves, the growth phase stabilizes, shedding slows, hair shafts become stronger. These changes don't happen because zinc gluconate is trendy or expensive. They happen because it respects how the body actually works. So when comparing zinc gluconate to zinc oxide for hair regeneration, the difference isn't minor, it's fundamental. Zinc gluconate's superior bioavailability and digestive tolerance make it far more effective at supporting keratin production, follicle repair, and a healthy hair growth cycle. Hair responds to what it receives, and zinc gluconate delivers where it matters most. When people struggle with hair loss, it's very natural to think in terms of dosage. If a little doesn't work, maybe more will. This mindset is exactly where many hair regrowth efforts go wrong, especially with zinc. Zinc oxide is a perfect example of how a supplement can look effective on paper, but fail in real biological conditions. The problem isn't that zinc oxide contains zinc. The problem is that it is poorly absorbed and often ineffective where hair follicles actually need support. This is why the right form of zinc matters far more than the dose. Zinc oxide is an inorganic compound. Its structure makes it highly stable, which is useful for industrial and topical purposes, but not ideal for nutritional absorption. In the digestive tract, zinc oxide does not dissolve easily. Without proper dissolution, zinc ions cannot pass through the intestinal lining efficiently. As a result, a large percentage of the zinc never enters the bloodstream. It simply exits the body unused. This creates a dangerous illusion. Someone may be taking a high-dose zinc oxide supplement and assume they are correcting a deficiency. Meanwhile, hair follicles remain zinc deprived. Over time, this leads to frustration and the false conclusion that zinc doesn't help with hair loss. In reality, the follicles were never getting what they needed. Hair follicles are especially vulnerable to this problem because they are not essential for survival. When zinc availability is limited, the body prioritizes organs like the brain, immune system, and liver. Hair follicles are placed at the bottom of the list. So even if a small amount of zinc from zinc oxide does get absorbed, it may never reach the scalp in meaningful amounts. This is why increasing the dose of zinc oxide rarely solves the problem. Higher doses do not guarantee better absorption. In fact, they can create new problems. Excess zinc in the digestive tract can interfere with copper absorption. Copper is also essential for hair health because it supports connective tissue formation and pigmentation. A zinc-heavy but poorly balanced intake can quietly worsen hair thinning over time. Another issue with high-dose zinc oxide is digestive irritation. Many people experience nausea, crampy, or discomfort when taking it, especially on an empty stomach. This irritation can reduce appetite, alter digestion, and impair absorption of other nutrients needed for hair growth. Instead of supporting hair health, the supplement ends up creating a cascade of nutritional issues. Zinc oxide also interacts poorly with common dietary components. Phytates found in grains, legumes, and seeds bind tightly to zinc oxide, making it even less absorbable. This means that in real-world diets, absorption can be dramatically lower than expected. Someone eating a typical diet may absorb only a tiny fraction of the zinc listed on the label. Hair loss caused by zinc inadequacy often presents subtly. It may show up as increased daily shedding, slower growth, or hair that never seems to gain thickness. Because these changes happen gradually, people often respond by adding more supplements rather than questioning the form they are using. This leads to supplement stacking without real improvement. The idea that more is better is especially problematic with minerals. The body relies on balance. Zinc must work in harmony with copper, iron, and other trace minerals. Overloading the system with a poorly absorbed form disrupts this balance without delivering benefits to the hair follicle. The result can be stalled progress or even worsening hair quality. In contrast, using a more absorbable form of zinc allows for lower, more physiologically appropriate dosing. Hair follicles respond best to steady, moderate delivery rather than sporadic spikes. Zinc oxide encourages people to chase numbers, while effective hair regeneration requires consistency and balance. Another reason zinc oxide underperforms is its inability to adequately support immune regulation at the scalp. Low-grade inflammation around follicles is common in hair thinning. Zinc helps calm this inflammation, but only if enough reaches the tissue. Poor absorption means zinc oxide often fails to influence this inflammatory environment, allowing the hair cycle to remain disrupted. Blood tests can add to the confusion. Someone may take zinc oxide and see a slight improvement in serum zinc levels, yet hair loss continues. This disconnect happens because serum zinc does not reflect tissue delivery. Hair follicles can remain deficient even when blood levels appear acceptable. This reinforces the idea that dosing alone is not the solution. Another overlooked factor is long-term compliance. Zinc oxide side effects make it difficult for people to take consistently. Missed doses, irregular timing, and stopping altogether are common. Hair regeneration requires months of uninterrupted support. A supplement that people cannot tolerate undermines the entire process. Zinc oxide is also commonly included in cheap multivitamins. The zinc content looks impressive, but the form is chosen for cost and shelf stability, not biological effectiveness. People relying on these products for hair health are often disappointed because the zinc never reaches the follicle in meaningful amounts. Hair regeneration depends on signaling. Nutrients act as signals that tell the follicle whether to grow or conserve energy. Poorly absorbed zinc sends a weak signal. The follicle remains cautious, staying in a shortened growth phase. Over time, this results in thinner, weaker hair. One of the most important shifts in thinking is moving away from milligrams and toward delivery. The right form of zinc allows the body to use lower doses effectively. The wrong form encourages higher doses with diminishing returns. This is not just inefficient, it can be counterproductive. People often ask why they see better results from dietary zinc sources than from supplements. The answer lies in bioavailability. Food-based zinc is naturally complexed with amino acids and organic acids that enhance absorption. Zinc oxide lacks this natural support system, making it inferior despite its widespread use. Stress further magnifies zinc oxide's shortcomings. During stress, zinc demand increases and absorption often decreases. A poorly absorbed form cannot meet this demand, leaving hair follicles unprotected during one of the most common triggers of hair loss. Over time, chronic reliance on zinc oxide can contribute to a pattern where hair thinning continues, despite doing everything right. This leads people to blame genetics, age, or hormones prematurely. While these factors matter, nutritional delivery is often the missing piece. The real lesson here is that hair follicles are precise. They respond to quality, not quantity. Zinc oxide fails not because zinc is ineffective, but because the form does not match the body's needs. Taking more does not fix this mismatch. When people switch from zinc oxide to a more absorbable form, they often notice gradual improvements without increasing dosage. Shedding slows, hair texture improves, and growth becomes more consistent. This shift highlights how critical form selection really is. So when it comes to zinc and hair regeneration, the message is clear. Zinc oxide is poorly absorbed and often ineffective for hair results. Chasing higher doses does not solve the problem and can create new imbalances. The right form of zinc, taken in a balanced and consistent way, matters far more than the number on the label. Hair growth is not about force, it's about giving follicles exactly what they can use in a form they recognize over time